So while I'm here, I'm going to check his TMJ, which will help him recover. And he's got a left TMJ. Adjusted that. One more time. I didn't get enough of it. Got it. Let me just check movement on his lower jaw. Okay. Nice. Hey there, it's Dr. Doug Willen, and here we are at Rising Starr Horse Rescue in Connecticut. So we're going to be working on some horses today. We're going to check them head to toe. If you want more information of Rising Starr, it's in the description below.
So this is Cyrano. We think Cyrano's 20 or older. He was surrendered with another horse. And this is somebody tried to do the right thing. They've gotten into some trouble where they can't take care of these horses anymore. They belong to their children, who are long gone. And, they were upstate New York and they had a vet telling them that they were fine and they didn't need this or that. I have their papers. And this horse had severe dental disease. Where actually his body was absorbing his teeth and it was very painful. So he just had a pretty expensive surgery and 2 nights at the hospital. You'll see he's got some shave marks. So he's just getting better and we're hoping that's going to help get some weight on him. We pulled blood and everything. And really he just couldn't eat. And if you see, he's a very big horse. He's actually gained weight since we've had him. And if you can't eat and your mouth hurts, that makes it hard to keep weight on them.
Right. So what we find, the mouth and the feet are big pain sources for horses. So when they're not right, the horse is not happy. So it's great that you did that dental surgery and are trying to correct some of the really deep underlying issues in his mouth, his teeth, infection. And he's, as you can see, he's already been gaining weight, but he's just making a comeback now. And that's what's exciting about, the work of these rescue farms is that the way that they can rehabilitate a horse and sometimes a very short time, 2 to 6 months, you see like total makeovers with
this is what Jeffrey looked like.
Yeah.
The last horse he did.
Yeah, so it's just amazing what the transformation and that's exciting to be able to take a horse and make a difference. So one of the things that I'm going to do today is just check for misalignment, see if there's any stress on the nervous system. It's much slower and harder to heal when your nervous system is under stress. I had a mentor that described when you work on animals, and it's the same for humans too, but I just loved it. It was an animal lecture, that we're really adjusting the nervous system and we're using the bones as levers to make little subtle changes to take pressure off the central nervous system and peripheral nervous system. And so I'm going to first go in here and check and see the spacing between the atlas and the wings of the atlas and the angle of the ramus of the mandible. And we're up here really high up. And so he's definitely got less space on the left atlas. So I'm going to adjust that first. So I'm going to come around this way. And I'm going to just do it. Once I see it, I'm just going to get in there and move it.
Good boy.
I didn't get it.
No. Oh,
Sometimes I can feel it when I get it. So I'm just going to do it one more time. Because that I got.
I heard that.
Yeah.
Oh boy.
So we'll just give him a second. And then I'm going to feel the spacing again. Okay, that's much better. Okay, so that's even now. Beautiful. So while I'm here, I'm going to check his TMJ, which will help him recover. And he's got a left TMJ. Adjusted that. One more time. I didn't get enough of it. Got it. Let me just check movement on his lower jaw. Good. Nice. Now I'm going to come down the cervicals. And he's got a big one right in here.
You're fine. I know.
So I'm going to bring his head towards me. Got it. So I just did C3 on the left. He's got a few things on the left. He also has
You're fine. I know.
right down here at C6. Oh, it went just on setup. So just as I brought him over and I was on the C6 vertebral body, it just started moving just as I set up. So that was beautiful. I didn't even have to do anything. It just guided itself right in. So I'm going to come down the back, and he's very twitchy as I come down. So as I come down here,
There's a lot going on. You're fine.
he's got some pain here, so we have to find the exact spot. Yeah. Well, here it is. So it's just below the withers. It'd be really nice to see him, what he looks like a month or two from now. Okay, so this rib is out. And I'm also trying to see which, oh, there it is. That was it. So I'm going to come carefully around him.
You're fine. You want me
And
to move them over a little
no, I'm fine. So there was one spot here. So this one might make him jump a little bit.
Okay.
So it's right below the withers right here. I got it. Good. Now he's quieting down there. Looking at his pelvis, you can see a lot. He's needs some more meat on this body, and that'll come back now. And I'm looking for he's got a right AS ilium. So I'm going to set up right here. I'm going to adjust his AS ilium. Got it. I'm going to check. There it is. So we get a little butt reflex. He's got a rib out here. He's got a few things.
You're fine. I gotcha.
Right here. Nice. Feeling all the muscles. Sacral apex, sacral base. There's still a little something at the sacral base, so I'm going to adjust that. And that's an important one. It helps the whole sacrum and ilium. He's tall, so I'm going to go all the way up. Got it. You can almost hear that one too. Did you hear that one, Ava? Coming down the back now. Do you see him twitch right there? As I come down here, he twitches when I get to the segment. Right there, do you see his shoulder twitch? So I'm going to push here and the shoulder twitches there. This whole area is sensitive. Good. Twitching gone. Oh, one more. Right there. Can you back him up just a little bit? That should come back towards me. I might have to move because I still got one spot left.
I'm doing good, baby. Oh,
Here it is. Got it. Nice. Ooh. That's it. Sorry about that. Now it's relaxed. You see that?
you're very good.
Cyrano, are you feeling good?
Yeah. I'm finding all the twitchy spots and relieving the nerve pressure on them. So he's calm now. We did a lot of different things. We did some ribs. We did some thoracic vertebrae. We did sacral base posterior. We did an ASLM on the right. We did cervicals, TMJ, a few things. Okay, so we're going to finish up there. We did a lot of stuff today, and I think it's going to be exciting to see him gain weight now in the next few months and recover from his surgery. If you have any desire to help out, this is a not-for-profit or nonprofit organization, Rising Starr Horse Rescue. There's information down below, and I also put the donate page link there if you want to either do a one-time donation or if you want to sponsor a horse too. It's very helpful. Thank you so much.